Welcome to my channel where we discuss books, nursing, medicine, university, and health related topics. Today we are going to discuss a health related topic, and it's a request from one of my students. Hi, Jackie. So just to give a shout out to Jackie. Jackie's the one who requested this, and for personal reasons that I won't say in the video. But today we're going to talk about sickle cell. Now, it's quite a medical topic, so I'm going to try to make it into layman's terms as much as possible. So I'll try not to use too many medical terms so everybody can understand what it is about. So let's talk about sickle cell. What is sickle cell? So sickle cell anemia is an inherited red blood cell disorder, and this happens when the red blood cells throughout the body are not shaped normally. So usually your red blood cell was shaped like a disc, but in sickle cell, it's shaped more like an S. So hence it gets its name sickle cell because of the shape of the red blood cell. So your red blood cell is usually like a disc, and it's flexible and it can move around and move through the veins easily. And with sickle cell disease, this is different. Now, you will hear people use the term sickle cell disease and sickle cell anemia. So what is the difference? So sickle cell disease is a group of conditions that are genetic and it affects the red blood cells, while sickle cell anemia is the name of a specific type of sickle cell disease. And this is when you develop sickle cell anemia when you have both parents with the sickle cell gene. Okay, so you don't get sickle cell disease only, you get sickle cell anemia as well when you have both parents with the sickle cell genes. So what is the treatment and what is the symptoms? The treatment is simple. It's usually blood transfusion. So they can do blood transfusion, and of course the symptoms is pain. Now, in terms of the treatment, there's other types of treatment such as stem cell or bone marrow transplant, and they tend to cure the disease, but it's not done very often, and that's because it's a very dangerous surgery and there's lots of risks involved. So stem cells, by the way, are special cells that produce bone marrow, and your bone marrow is where your blood is made, and this is a spongy tissue in the center of the bones. So in the treatment, they will usually replace the bone marrow, and that is quite dangerous, and so it's not done often. To be honest with you, I've never met anyone that it's been done to, so I'm not sure often it is done. And as I say, symptoms is really pain, and this is pain all over the body. So in episodes of pain, the episodes of pain develops because, as I said, the blood cells are not disc shaped, they're sickle shaped, and because of the shape of them, they tend to block. When they're flowing through the tiny blood vessels, like in your chest, your abdomen, your joints, then it will block these blood vessels. And when it blocks these blood vessels, it becomes very painful. So most people with sickle cell anemia or with sickle cell disease will have pains in their bones. So they'll have a lot of bone pain. And anyone who's had bone pain, they know that bone pain is, it's like a pain that feels like it's never going to go away. I broke my shoulder, and I've never felt pain like that in my life. So I understand bone pain. And so sickle cell disease, you tend to have bone pain. And the pain can vary with intensity. It can last for a few hours or a few weeks. And for people, I've known people who've been in the hospital for 6 weeks, so it can last for some time. And some people have crises a few times a year, other people have crises every month, and some people have crises once a year. So in these people, one of the things to advise them as a nurse or any healthcare provider is to avoid strenuous exercise. So people with sickle cell disease, they should be active, but they shouldn't really do exercise that's too strenuous, because the more you exercise, the blood cells go around the body at a faster rate, and then it becomes stuck and it becomes painful. So intense activities should not happen. Anything that makes them very breathless, then they shouldn't do that, because when that happens, it means that the blood cells will go around the body more often. They should do the usual things like don't smoke, Smoking makes your blood sticky, and alcohol, don't drink alcohol because alcohol makes the blood thin. So one on the other spectrum, but it causes the same side effects. So you avoid these things. And alcohol also makes you dehydrated, and if you're dehydrated, your blood can be sticky as well. And of course, smoking can trigger lung conditions, and in lung conditions, it can become painful because that's where your gaseous exchange for your breathing takes place in your lungs. So let's ask the question: who gets sickle cell? Sickle cell trait can affect most ethnicities. So you're thinking of people from South America, South Asians, a few Caucasians, but when in terms of Caucasians, it's people from Southern Europe, people from the Middle Eastern countries, but it's most common in Black and Afro-Caribbeans. That's the most common group. Now, in terms of age, the modal age for sickle cell disease is actually, so the modal age that they diagnose sickle cell disease in children is between 13 months and 36 months. So if you've got a child, by the time they get to 13 to 36 months, you will start noticing that something's wrong. Statistics, 10.4% of the people with sickle cell are diagnosed by 6 months. 35.7% are diagnosed in infancy, and 21% will be diagnosed by the time they're 5 years old. So this disease is diagnosed quite early. And if you know anyone with sickle cell, and I've known quite a few people, when I was making this video, I actually had that conversation with my mom. And because we grew up with a family that, I think there was 4 children and everyone had sickle cell except one of the 4. So, and they were forever in and out of hospital. So it's quite, it's quite a serious disease. So life expectancy, they don't have a long life expectancy. Life expectancy is usually between 42 to 47 years, and that's very young. So people with sickle cell disease tend to face many challenges, and one of them, of course, is the pain. However, they can develop stroke, because you can imagine that a stroke is if there's a bleeding outside, or there is a clot formation. So clot formation is similar to the sickle cell blood cell being stuck. So the sickle blood cell being stuck. So it's the same thing. And of course, this can damage the organs. And if you think of organs like the kidney that has a lot of tubes, but very small tubes, then this can cause a lot of issues. However, having said that, these people, the average age is 42 to 47 years. The oldest person known to have sickle cell is a Japanese lady, and she lived to the age of 94. So, and hopefully with science and stuff, it will all pick up. And so that's something, actually, if my students are watching this, this is something that they can do their research in for their dissertation. This would be a good research area. And also, if you become a research nurse, you can, delve deep into this area. So if you're Black or from a, ethnic minority group that suffers with sickle cell a lot, then it might be worth you investing your time into finding out how we can cure this and how we can treat this better instead of just giving pain medication. So what triggers a sickle cell crisis? Now, sickle cell crisis, by the way, is when these people are hospitalized. So what triggers a sickle cell crisis? So sickling is what a sickle cell crisis is called, might be triggered by conditions that causes low oxygen. So this is what we were talking about when we talk about exercise. So conditions that triggers low oxygen. So if the blood acidity is increased, if the immune system becomes low, and common triggers can be like the temperature. So if you live in places that are cold, England's cold in the winter, the UK is cold, not just England, the UK in general is cold in the winter. Some parts of the USA is cold. And these people, when it's cold, you know that your blood vessels get narrow. So you've got this odd shape blood cell, and the blood vessels are narrowing on you. So that means that you're more likely to be in pain, and you're more likely to have shortage of oxygen because of this. So yeah, what should these people eat? They should eat a variety of food, so a rainbow of food, so the same foods that we eat. However, they do say that these people should eat more protein, so more eggs, more fish, chicken, meats, and all those sort of stuff, and get plenty of calcium-rich food, because calcium-rich foods are known to reduce sickle cell triggers. I tried to find out why, but I couldn't find out why. It just says that it does. So they say they do recommend things like milk, yogurt, and cheese for children who suffer with sickle cell. And I'm just going to find out why. What's the calcium got to do with it? I'm sure it's probably, I'm thinking here, it probably strengthens the bones. So it could be that. Okay. One of the questions I received is, does the cold weather affect sickle cell? And the answer is yes, because we spoke about that. So exposure to cold air, wind, water can exacerbate or trigger a sickle cell crisis, or sickling as we know it. So we should dress our children warm. So if you've got children with sickle cell, you need to dress them very, very warm. Layer them up with clothes. Is the crisis an emergency? It can be. So for sickle cell crisis, when the severity of pain is very, very high, it can be an emergency. If the pain isn't too bad, then they can treat themselves at home. I specifically over the years remember having two patients, two girls actually, and they used to treat themselves at home. And there's one that we had to call her in and cut her off because she's always requesting pethidine. And pethidine, as you know, is a CD drug and it's very addictive. And I think at 18, she was definitely addicted to pethidine. She used to use 1 week's pethidine probably in 2 days. But I think she became dependent on it. She wasn't using it only for a crisis. She was just using it because she's dependent on it. So those are the two patients that I can remember that, would treat themselves at home. These people have a consultant in hospital. That's for the UK, by the way. I'm not sure what they do in the USA. They have a consultant and they can call their consultant or call the consultant secretary and ask to be booked into the clinics. And when they're booked into the clinics, they usually get an appointment for the next day. So they can go in and discuss if they're having a crisis or they think they might have a crisis. Because after a while, these people will know when they are going to have a crisis. Can you get sickle cell? Can my baby get sickle cell? Actually, I'm trying to remember the questions that was asked. I think I had 3 questions. So that was the first one about the emergency, and I think the second one was, how does my baby get sickle cell? So women with sickle cell disease can have healthy pregnancies, so that doesn't affect the baby at all. The pregnancy doesn't affect the baby. They do need extra care with prenatal care and stuff like that, and they need to be monitored during pregnancy, but the pregnancy will be fine. They usually only have problems in pregnancy if they're not healthy. But most of us when we're pregnant, we know to eat healthy, walk around, get a little bit of exercise and stuff like that. With sickle cell disease, of course, not strenuous exercise, but just do enough to make sure that our babies are healthy. And what are the chances of their babies getting sickle cell? If both parents have the sickle cell trait, there is a 1 in 4 chance. So there's a 24% chance of your child having the disease if both parents have the sickle cell trait. If there's also, by the way, there's also a 1 in 4 chance that any child of that union will be affected by the disease. So if you have 4 children, 1 of the 4, and if you're unlucky, maybe 3 of the 4 might have it. There's also a 50% chance that any given child might have it. So let me go back over that. What are the chances that their offspring will have sickle cell anemia? If both parents have sickle cell trait, there is a 1 in 4 chance that any given child could be born with sickle cell. There's also 1 in 4 chance that any child could be completely affected, and there is a 50% chance that any given child will have the trait. So in England, they tend to test you for the sickle cell disease trait. They tend to test you before you become pregnant. So anyone out there who is at the age that they want to become pregnant, you and your partner need to be tested, because then that's a decision you'll have to make. I mean, I can't envision anyone leaving their partner and saying, "Oh, you've got sickle cell trait, and I've got sickle cell trait. My child might." No, I don't. I definitely can't think of anyone who will do that. But it gives food for thought that you're prepared that any child you have might have the disease. How do you know if your baby has sickle cell? People will soon find out because there's signs. They tend to be pale. They tend to be more tired. They don't run around as much because they get tired. They can get fast heartbeat, and they can develop things like hand, foot, and mouth syndrome. Also, another thing, especially in very warm climates, in very cold climates, these children will get painful swelling of the fingers and toes, and then, after being tested, they will find out that they've got the sickle cell trait. These children also develop a lot of skin infections, so a lot of bacterial infections, and that's because they're at risk because of their risk of diseases because of the sickle cell, which is quite sad if you think about it, because in childhood, a child needs to be active and running around, and then all of a sudden they're getting bacterial infections, they're becoming unwell, they're breathless, they can't climb a tree. Not to say children are climbing trees these days. Children are climbing trees anyway, so I don't know why I'm thinking that children are playing on their PlayStation. So maybe their fingers are too swollen and they can't play their PlayStation. So then you're thinking something is wrong. Now, what relieves sickle cell pain? So if you're monitoring yourself at home and you're in pain, things like ibuprofen, so NSAIDs, ibuprofen, diclofenac is quite good. If the pain persists, then opioids can be introduced. I think in the UK you can buy cocodamol over the counter, but healthcare is free to the point of delivery here, so they'll have lots of medication that they give. If it becomes a crisis, then of course it will be pethidine, heroin, morphine, those sort of drugs will be given but in hospital under supervision. Please, in hospital under supervision. Okay, so let's wrap up everything that I said. So sickle cell disease, I'm going to wrap it up from NHS Choices because I think really it will give a simpler explanation. As my students know, I always say to them, don't write things from NHS Choices because we are medics and we need to, we're medical clinicians and we need to use clinician terms. But as this video is for the general public, general population, I'm going to wrap it up in NHS Choices terms. So NHS Choices says that sickle cell disease is the name of a group of inherited health conditions that affect the red blood cells, and the most serious type is called sickle cell anemia. Sickle cell disease is particularly common in people with African or Caribbean family background. Common, but not exclusive to. Okay, so do remember that. That's common, but not exclusive to. So people with sickle cell disease produce unusual shaped red blood cells, and this can block the blood vessels and cause pain. And it's serious and it's lifelong. And I think if you haven't taken anything away from this, do know that it can cause a lot of pain, and it's serious and it's lifelong. So if you're thinking of getting pregnant, then of course you should do your test to make sure that you are okay. So that's it for sickle cell disease. If you have any questions, put them in the comment section, and I will answer them as soon as I can. Maybe somebody who is reading or watching the video will also have answers for you. So by all means, please like, share, and subscribe. And if you have a topic that you'd like me to discuss, then please just put a comment in the comment section, or you can join me on Instagram. I always leave my Instagram and my Facebook on in the description box, so you can join me on Instagram and send me a message on Instagram, and I will see it and make a video. So thanks for watching, and I will catch you later.